Here is your stem. There's little bit on the next slide. So once you've done reading, please let me know.
Okay. Okay, ma'am. Okay, ma'am.
Okay, ready? So if you've
Yes, ma'am.
read and understood, considering it critical care scenario, please tell me how would you manage this patient now?
Okay, ma'am. I'll consider the patient is the acute abdomen and some differential diagnosis. It may be the case of acute pancreatitis, acute cholangitis, acute cholecystitis, or perforated viscous. And I'll manage the patient according to the conservative treatment. I'll keep the
According to the
patient
critically ill patient.
critical ill
Yes,
patient management
yes,
protocol. Yes,
yes.
critically ill patient
And you'll
protocol.
begin with
I'll admit the patient in the ASD or ICU.
yes. And what would you do next? Please tell me the whole step by step
Yes,
management.
yes. Then yes, ma'am. Yes. I can say, ma'am. I'll give the central venous line for rehydration of the patient for monitoring purpose and for the TPN. Then I'll considering the analgesia according to the WHO analgesics pattern. No
WHO,
morphine or
World Health
no
Organization.
NSAID.
Yes.
I'll give the paracetamol and weak opioids like the codeine, then strong opioids, the pethidines. Then I'll give the nasojejunal feeding the patient. And then I'll consider the reduce the secretion by using the octreotide
Okay.
and antibiotic
Thank you.
according to the local test policy.
Yes, thank you. Please tell me after you've read the stem, what are the differential diagnoses that you'll consider for this patient?
Yes, ma'am. It may be case of acute relapsing pancreatitis, may be case of acute cholecystitis, acute cholangitis, or the perforated viscous.
All right. Okay. If we consider as acute pancreatitis or relapsing pancreatitis case, what are the causes which causes acute pancreatitis?
Okay, the causes includes the alcoholism, the gallstone, uh, after trauma, abdominal trauma, post ERCP, hyperparathyroidism, hypercalcemia, some drugs like thiazide,
Infection.
some infection. Yes, ma'am. Post
Right.
ERCP.
Hmm. Okay. Please tell me what is the pathogenesis behind acute pancreatitis? What
Okay,
happens?
ma'am. Mainly, yes. Two theory, the duct obstruction, here the reflex of the bile into the pancreatic duct, increase the interductal pressure that causes the destruction of the acinar cell and release of the pancreatic enzyme and cause the autodigestion of the pancreatic cell. And another theory is the acinar cell destruction by trauma, drugs.
Yes. Viruses, bacteria, etc. All right.
Yes,
Please tell me
virus, bacteria.
what are the criterias? How many criterias you know of which can help you in diagnosing acute
Yes, ma'am.
pancreatitis?
There are
Hmm?
criteria. It includes the Glasgow score criteria, Ranson
Yes.
score criteria,
Yes.
then Ball Hart's criteria,
Yes.
then the Apache score 2.
Very good. Please tell me about the Renson's criteria on
Yes, ma'am.
admission. What would you
Yes,
consider?
Yes, at admission, I'll consider the age of the patient more than 55 years, white
Yes.
cell count more than 16,000, blood glucose level more than 11 millimole per liter, enzyme LDH level more than 350 unit per liter, and the AST more than 250. And
or
after
200. All right.
48,
Okay, please tell me, how does the score of a patient relates to the mortality?
yes, ma'am, if the rate score is 0 to 2, 0 to
Yes,
2, then 2% mortality rate, 2 to 3 to 4, 15%, 5 to 6, 40%, 7 to
very
8,
good, very
100%.
good. Okay, please tell me why on examination patient was tachypneic.
Yes, ma'am, it may be the cause of the abdominal pain, pressure effect, if there's develop of the pseudocyst, and the respiratory problem, that is the ARDS, complication of the
Okay,
pancreatitis.
this ARDS is abbreviation for what?
Adult acute respiratory distress syndrome.
All right, please tell me. All right, okay. Why? All right, if you could comment on this, sorry, on the serum amylase level, which was 3,400
Yeah.
unit per liter. What do you consider this? What do you think of it?
Yes, I'll consider it's a more than fourfold increase, but
Okay,
amylase is not the specific.
very good. Which enzyme is then? Which blood
Yes,
test is?
lipase is more
Serum, serum lipase.
important than the amylase.
Very good.
And
Okay.
I also
The-
consider the LDAs also.
all right. Okay, that can also be DH. Okay, or it AST. All right. Okay. Please tell me. In which there are two occasions in which serum amylase is normal, but patient is suffering from acute pancreatitis.
Serum amylase normal.
Yes,
Um,
but patient is suffering from acute pancreatitis.
it may be idiopathic pancreatitis, ma'am.
Mm-mm-mm-mm. It is too early or too late.
Yes,
When it
yes,
is
too early.
done
Yes,
before, yes,
yes, ma'am.
normal
Sorry.
after
Yes,
48 hours of
yes,
attack,
yes,
or it is when
yes,
it returns back. Okay, please tell
yes.
me, if you fail to manage your patient with acute pancreatitis, what are the complications that can occur?
Okay, ma'am. There are lots of complication. Local complication includes the pseudocyst formation, abscess, ascites, splenic vein thrombosis,
Very good.
and
Yes.
then hematological disseminated intravascular coagulation, hematological the jaundice, portal vein thrombosis,
Okay.
cholangitis.
Very good.
Then systemic, it includes the hypovolemic shock, hemorrhagic
Okay. Right.
pancreatitis.
Please tell me, how would you take care of the nutritional status of the patient in acute pancreatitis?
Okay, ma'am. I'll consider the nasojejunal or nasoduodenal feeding, and I
Yes.
also consider if the patient is severely acute pancreatitis, then I'll consider the TPN, central venous line.
Okay. Total parenteral nutrition,
Oh,
TPN.
sorry, total parental
Yes.
nutrition.
All right. Please tell me, would you consider giving antibiotic to the patient in acute pancreatitis or not?
Yes, ma'am. Yes, ma'am. I'll consider the antibiotic according to the local trust policy if the patient having the cholangitis, sepsis, or necrosis of the pancreatic tissue.
Okay. Which antibiotic in that case would you
Yes,
consider?
yes, ma'am. It's maybe the quinolone or there is one another
Carbapenem.
carbamide. Yes, ma'am.
Yes.
Carbamide.
All right. Okay. In case, all right, in case that in order to manage the pain of the patient, you have started with the
Yes.
non-steroidal anti-inflammatory medications. And how would you realize, or how would you know that this has caused overdose and has led to liver injury?
If the CRP level is increased,
No, there is another. There
uh,
is something else. If you'll do liver function test, you'll
yes,
realize
liver function.
there's accumulation of toxic metabolite.
Yes, ma'am. Yes, ma'am.
Which one?
I read, but I forgot me.
NAPKY.
Yeah,
So
yes,
that is
NAPK. Yes,
neutralized by the glutathione, and excess amount of
yes, ma'am.
acetaminophen that is taken, that neutralizes this, and it will be accumulated in liver, and that will it will affect the liver functions of the patient.
Yes, ma'am.
Okay, that's why when you were saying LDH, I thought AST because normally liver function tests are also deranged if there is acute pancreatitis. Okay, thank you.
Yes, ma'am. Thank you, ma'am.